For over 3 decades, I have observed 2 very different types of patients walk through my clinic doors. Some arrive on their own. Others need assistance getting in. What surprises most people is this. The difference between those 2 outcomes has little to do with pain levels, age, or misfortune. It comes down to one thing: leg strength. Quietly, gradually, week after week, something begins to shift after the age of 60. Your legs start losing strength, even when you feel perfectly fine. Not suddenly, not in any dramatic way, but steadily and consistently. Most people don't notice until familiar tasks begin to feel different. Getting up from a chair takes just a moment longer. Stairs feel a little steeper than they used to. You pause before stepping off a curb. You find yourself reaching for furniture you never needed before. These are not simply normal parts of growing older. They are early indicators of muscle loss. And there is a medical term for this condition: sarcopenia. The problem/science of declined sarcopenia refers to the age-related loss of muscle mass and strength. According to a large clinical review published by the European Working Group on Sarcopenia in older people in 2019, adults over the age of 60 can lose up to 3 to 5% of leg strength every single year if that strength is not actively maintained. This means weakness doesn't wait until your 80s. It begins now, quietly, while you are still living your normal daily life. Here is where a great deal of well-meaning advice falls short. You have likely been told to walk more, stay active, and get your steps in each day. Walking is genuinely beneficial for your heart, your circulation, and your mood. But walking alone does not stop leg muscle loss. A 2021 study from McMaster University followed adults between the ages of 60 and 80 and found that regular habitual walking did not significantly preserve lower body strength or power, the very qualities needed to prevent falls and maintain independent movement. In other words, you can walk every single day and still grow weaker. That is not a personal failure. It is the result of incomplete guidance. Why resistance matters/the real stakes muscle does not respond to movement alone. It responds to resistance. After the age of 60, your nervous system activates fewer muscle fibers unless you deliberately challenge them. The fast response muscles responsible for balance are the first to weaken. Once they do, the body naturally compensates by slowing down and moving more cautiously. That's the point at which confidence begins to fade, often without the person even realizing it. This is the true subject of today's discussion. Not fitness, not physical appearance, not personal records. The real concern is independence, the ability to rise from a chair without assistance, to climb a flight of stairs without gripping the railing, to recover your footing when you stumble, to fully trust your legs again. The encouraging news is this: this decline is manageable. It can be reversed, and it does not require a gym membership or specialized equipment. In fact, some of the most effective leg-strengthening movements for adults over 60 can be performed while seated in a chair. Introduction to the exercises today. I, Dr. Thomas, will walk you through 5 chair-based exercises that directly target the muscles most responsible for standing, balance, and fall prevention. They are straightforward, low-risk, and supported by clinical research. One of them, however, stands above the rest, and most people overlook it entirely. I, Dr. Thomas, will explain why and how to use it safely toward the end of this video. Study references are available in the description below. Before we begin, we'd love to hear from you in the comments. Share your age and where in the world you are watching from. Here on the Dr. Thomas channel, we read and respond to every single comment personally. Now, let's get started with number 5, and this one may surprise you. Exercises 5, 4, and 3. Exercise 5. Seated knee extension. Many people underestimate this movement because it appears effortless. There is no standing, no strain, and no visible exertion. But medically, it targets one of the most critical muscle groups in the aging body, the quadriceps femoris, the large muscle group running along the front of the thigh. The quadriceps are responsible for straightening the knee. They control the action of rising from a chair. They stabilize you when walking downhill and absorb impact when you misstep. When these muscles weaken, the first ability people lose is confidence when standing from a seated position. The second is stair control. Shortly after, they begin using their hands to push themselves up. A 2018 study from the University of Pittsburgh's Department of Geriatrics identified reduced quadriceps strength as one of the strongest predictors of future mobility disability in adults over 65. How to perform it? Sit upright in a firm chair with your feet flat on the floor and hips pressed to the back of the seat. Slowly straighten one leg until the knee is fully extended, not forcefully, but in a controlled manner. Take 2 seconds to lift. Pause briefly at the top. Then take 3 seconds to lower the leg back down. That slow lowering phase is where the real muscle rebuilding occurs. Begin with 8 to 10 repetitions per leg, 1 to 2 sets, once daily. As Dr. Thomas recommends, if the movement feels comfortable after 2 weeks, add a third set. Exercise 4. Seated heel raises. This movement is frequently overlooked because people associate calf strength with athletic performance. Medically, however, the gastrocnemius and soleus, your calf muscles, are primarily balance muscles. They govern ankle stability, correct body sway, and serve as your first line of defense when you lose footing. A 2020 balance study from Kyoto University in Japan found that reduced calf strength significantly increased fall risk in adults over 70, independent of overall fitness level. The key insight: you don't fall because your entire body is weak. You fall because one system fails to respond quickly enough. How to perform it? Sit upright in your chair with feet flat on the floor, hip width apart. Slowly raise both heels, keeping the balls of your feet grounded. Rise as high as you comfortably can. 2 seconds up, a brief pause, then 3 seconds to lower. Perform 10 to 15 repetitions for 2 sets. As Dr. Thomas advises, as strength builds, progress to single leg heel raises for greater challenge. Exercise 3. Seated marching. This movement is often mistaken for a simple warm-up. It is not. When performed correctly, it strengthens the hip flexors, lower abdominal stabilizers, and the deep muscles that govern pelvic balance. The muscles that determine how well you clear your foot with each step, prevent shuffling, and reduce tripping. A 2019 study from Monash University in Australia showed that improving hip flexor strength significantly reduced gait instability in adults over 65. How to perform it? Sit tall, do not lean back. Slowly lift one knee toward your chest, only as high as you can control, then lower it. Alternate legs at a steady tempo, 2 seconds up, 3 seconds down. Perform 10 repetitions per side, 1 to 2 sets. As Dr. Thomas suggests, if balance allows, release your hands from the armrests to further engage the core and hips together. Mid-video engagement prompt. If you have found this information from Dr. Thomas useful so far, please hit the like button. It helps more older adults discover this content. And if you haven't already, consider subscribing to the Dr. Thomas channel. New videos focused on senior strength, balance, and independence are published regularly, and you won't want to miss what's coming next. The final 2 exercises are where meaningful strength preservation truly takes place. And number 1 is the most underutilized movement in senior health today. Exercises 2 and 1. Exercise 2, seated sit-back control, partial chair squat return. Most people assume that strength loss alone causes falls. Clinically, that is only part of the picture. What actually contributes to many falls is the loss of controlled deceleration, the capacity to slow the body down intentionally. The muscles responsible for this are the gluteus maximus, the hamstrings, and the deep stabilizers surrounding the hip joint. These muscles don't only help you stand, they help you sit down safely. A 2020 study from the University of British Columbia found that older adults who lacked controlled sitting strength were more than twice as likely to experience balance-related falls within a 12-month period. Here is why this matters beyond fall statistics. Every time you drop quickly into a chair or collapse onto a seat, your brain begins to associate that transition with instability. Over time, you start avoiding standing and sitting altogether, and that is how independence shrinks gradually, without anyone noticing. How to perform it? Sit at the front edge of a sturdy chair, feet flat and hip width apart. Cross your arms lightly over your chest, or keep your hands hovering near the armrests for safety. Lean slightly forward from the hips. Begin to rise just a few inches, then slowly lower yourself back into the seat. The lowering is the critical phase. As Dr. Thomas emphasizes, take 4 to 5 seconds to return, slow and controlled. Start with 6 to 8 repetitions, 1 to 2 sets every other day. As strength improves, gradually increase the depth of the rise until it becomes a full sit to stand with a fully controlled descent. Exercise 1. Seated leg press hold, isometric push. This is the most overlooked exercise in senior health, and according to Dr. Thomas, the most important. It doesn't resemble conventional exercise, but neurologically, it is one of the most powerful methods for preserving leg strength after 60. This movement trains isometric strength, the ability to generate force without any joint movement. And that is precisely what your body requires when you catch yourself mid-fall. The primary muscles engaged are the quadriceps, glutes, and hamstrings, all working simultaneously as a coordinated unit. A landmark 2017 study from the University of Copenhagen demonstrated that isometric leg strength training improved functional performance and reduced fall risk in adults over 70, even without any dynamic movement involved. How to perform it? Sit upright in your chair with feet flat on the floor. Press both feet firmly into the ground as though you intend to stand, but do not stand. Hold that pushing force for 10 seconds. Breathe normally. Do not strain or hold your breath. Release and rest. Repeat 5 times, once per day, as Dr. Thomas recommends. As this becomes more manageable, extend the hold to 15 seconds. This exercise trains the nervous system to activate muscle fibers rapidly and efficiently. Dr. Thomas particularly recommends it for individuals with painful knees or hips because it strengthens the legs without any joint movement. And most importantly, when you stumble, you don't have time to think. Your legs must respond on their own. This exercise trains exactly that response. Closing/call to action, we have now covered all 5 movements that Dr. Thomas recommends. But understanding these exercises is only the beginning. What truly matters is how they become part of your regular life. Let's bring everything together, because strength after 60 is not built by doing more. It is built by doing what is most relevant. Today, Dr. Thomas focused on 5 chair-based movements, each one addressing a different system your legs depend on every day. Your quadriceps, which lift you from a seated position. Your calves, which steady you when your balance shifts. Your hips, which help your feet clear the ground as you walk. Your glutes and hamstrings, which manage the controlled transitions between sitting and standing. And finally, your nervous system's capacity to generate strength in an instant. Together, these movements address what genuinely matters as we age: balance, mobility, and independence, not fitness performance or physical appearance, but the prevention of avoidable decline. Notice something important about everything Dr. Thomas has covered today. None of it required a gym. None of it required equipment. None of it involved pushing through discomfort or pain. What it required was targeted resistance for a few minutes, a few times each week. Clinically, Dr. Thomas knows that even 2 to 3 brief sessions per week of properly selected lower body resistance work can slow muscle loss, enhance balance, and preserve function well into the later decades of life. Progress does not need to be aggressive. It needs to be consistent. Small, controlled movements. Gradual progression. Listening to what your body communicates. That is how strength stays with you over time. At this stage of life, the goal is not simply adding years. It is adding quality of movement to every year you have. If you'd like, share in the comments which exercise you plan to begin with first. Dr. Thomas genuinely reads every comment, and your experience encourages others who may be watching and feeling uncertain. If you'd like more clear, research-supported guidance on staying strong, steady, and self-sufficient as you age, consider subscribing to the Dr. Thomas channel. New content is released regularly, all focused on helping you move with confidence for as long as possible. You are not too late. You are not behind, and your body remains fully capable of responding when guided by the right advice from Dr. Thomas.